everyone, and welcome back to Navigating the Periphery. My name is Deborah, and this is my son Philip.
Hello.
How is everyone doing today? If you're into what we're doing on this channel, you guys know what to do. We want to try and get our message out there and try to reach and help as many people as we can. Because here at Navigating the Periphery, we are trying to stop the stigma of a mental health diagnosis one show at a time. If you know anyone who could benefit from watching our channel, please help. Show stealer again. Spread the word.
Remember, it's okay not to feel or be okay all the time. You guys and gals are not alone. We are here.
So Philip, how are you doing today?
I'm doing great today, Mom. How are you doing?
I am good and excited to discuss today's topic, but first, a brief disclaimer here. We are not medical professionals or doctors.
No, we're not. Our channel is for information and education purposes only, and I'm speaking to you guys and gals out there from my personal life experience with OCD, GAD, and my schizoaffective disorder. So please refer to our full disclaimer at the end of this video and every episode that we put out. Today, we're going to navigate the periphery of a question I get asked a lot. Who are you, the thinker? I get asked a lot since my diagnosis of schizoaffective disorder, and that question is, wow, you have schizoaffective disorder? Have you experienced any childhood trauma or any trauma in general? That answer is no. But there's more to the story. I did experience trauma a while ago, attending college, and I'll touch on that later in this episode.
Now, there's a relationship with trauma and schizoaffective disorder. Trauma does not cause schizoaffective disorder, but it is a strong risk factor. Anyone who has experienced trauma, especially in childhood, is at greater risk of developing a psychotic symptom or condition, like schizoaffective disorder. Because these conditions and symptoms are similar, it is essential to get an accurate differential diagnosis. Now, a differential diagnosis is a process that helps a medical professional determine which mental disorder is causing a patient's symptoms. A medical professional will ask about the patient's symptoms, medical history, family health history, life, and habits. This is the first step in planning and initiating the treatment that will help an individual cope with trauma and live and manage a chronic, serious mental illness.
Yes. Trauma in any form can lead to schizoaffective disorder, post-traumatic stress disorder or PTSD, and many other mental health conditions. PTSD can also include psychotic symptoms like hallucinations and delusions, like schizoaffective disorder. Schizoaffective disorder also causes psychosis, and there may be a connection between these two conditions. It's not accurate to say that trauma causes psychotic conditions, but it is a definite risk factor. With such similar and overlapping symptoms, it is essential that patients get accurate diagnoses and relevant treatment for all existing conditions. Schizoaffective disorder is a serious mental illness that causes psychotic symptoms as well as symptoms of bipolar, depression, or mixed. The bipolar aspect of this condition can trigger episodes of depression and mania, as in my case, because I have schizoaffective disorder mixed type, or just mania as in schizoaffective bipolar type. During a depressive episode, a person may feel sad and hopeless, have low energy, be uninterested in normal activities, and avoid social interactions, while mania causes high energy, euphoria, racing thoughts, and impulsive behaviors.
Psychosis caused by schizoaffective disorder includes symptoms related to losing touch with reality. They include delusions, hallucinations, disorganized and confused thought patterns and speech, low emotional affect or response, and unusual behaviors like inappropriate reactions, aggression and anger, childlike behaviors, and strange or repetitive movements. The age of onset for schizoaffective disorder varies, but most people first exhibit signs between the ages of 16 and 30. We don't know what the exact causes of this condition are, but family history is an important risk factor. Another proven risk factor which links schizoaffective disorder to PTSD is the experience of trauma. Trauma is the underlying cause of post-traumatic stress disorder, but experts don't know for sure why some people go through trauma and never develop PTSD, while others do. Family history certainly plays a role, and other risk factors include severe or recurring trauma, a poor support system, substance abuse, and other mental illnesses.
An extensive review in scientific studies has definitively confirmed that trauma puts people at risk for psychotic conditions and symptoms. The researchers looked at 3 different groups of people: those who experienced trauma as children, those who have experienced psychosis as adults, and random adults from all groups. The connection was clear. The study showed that children who experienced trauma before the age of 16 were 3 times more likely to have some type of psychosis as adults. Severe trauma increased the risk by 50 times. How trauma may trigger psychosis and put people at great risk for conditions like schizoaffective disorder is not known. However, some ideas include the impact of trauma on the developing brain. Children's brains are still growing and developing, and a traumatic experience may cause a disruption or damage that later leads to psychosis. But this is where my case or experience differs from that.
Philip was diagnosed with obsessive compulsive disorder, or OCD, and generalized anxiety disorder, or GAD, at 8 years old, and was prescribed medications to control those 2 issues. But aside from that, he had a pretty normal life, involving no childhood trauma. However, some studies suggest shared genetic factors between OCD, GAD, and schizoaffective disorder, showing a potential common underlying vulnerability. Some individuals with childhood OCD may later develop psychotic symptoms or mood disorders, which are components of schizoaffective disorder. While not common, there are cases where childhood OCD transitions into schizoaffective disorder or other psychotic disorders later in life. And we discussed this in a past episode called the OCD Schizoaffective Link, which is episode 45, and we will leave a link to that episode in the description box below.
And while attending college in 2020, my entire family contracted COVID, and my mom was seriously ill from COVID. So already having OCD and GAD, and being sick with COVID myself, compounded by almost losing my mom, there lays the trauma I was talking about earlier in this episode. It was a perfect storm of stress and trauma to ignite my schizoaffective disorder mixed type. For individuals predisposed to schizoaffective disorder due to genetic or biological factors, traumatic events may act as triggers for the onset or exacerbation of symptoms, and stress from trauma can precipitate psychotic or mood episodes. So hello, here I am.
There you are. So going back to the have you experienced trauma, the answer is yes for Philip, just not childhood trauma.
I don't think the realm of trauma can be put in a box when it comes to mental illness, especially when there are genetic precursors, which I have in my family. Also, the precursor of having childhood OCD and GAD, the stress of college, and then the COVID pandemic.
What is key here is the importance of a differential diagnosis, which again is a process that helps a medical professional or doctor determine which mental disorder is causing the patient's symptoms. It can be very challenging to diagnose mental illnesses with overlapping symptoms because they're so similar. Mental health professionals should be the ones to diagnose patients who have symptoms similar to multiple illnesses such as GAD, OCD, schizoaffective, or even PTSD with psychosis.
Trauma is widely recognized as a significant factor in the development, progression, and severity of many mental illnesses. Trauma can result from a range of adverse experiences such as physical, emotional, or sexual abuse, neglect, exposure to violence, natural disasters, or other life-threatening events. Its impact varies from individual to individual, influenced by factors such as age, support systems, and genetic predisposition, which, hello, I have all those things. It just wasn't during my childhood. So I hope that answers the question of, have I experienced trauma? But I enjoy all of your questions. I will always answer honestly because I never want anyone to feel alone in their diagnosis. And please remember, it's okay not to feel or be okay all the time. You are not alone, and we are here.
Yes, we hope we answered your question on what, if any, Philip experienced any trauma.
Yes.
So please leave your thoughts and comments below. We will leave the link to that other episode, the OCD Schizoaffective link, which, by the way, is our most viewed episode on YouTube. And we will see you in our next episode coming really, really soon. So until we see you again, take care, have a wonderful evening, and bye for now.
Bye!